Welcome to the Real Integrative Medicine podcast. I'm Dr. Jordan Robertson, and I'm here to bring you the tools, insights, and strategies to take your health to the next level while using evidence-based integrative medicine. What's real? This is what we want to explore together. Research is ever-changing and not easy to interpret. We're bringing you the best that integrative medicine has to offer while sticking to the facts. Our mission is to elevate the practice of integrative medicine for clinicians and patients alike. Preventative solutions, nutrition, exercise, and sometimes supplements have a seat at the table in medicine, but only if we uncover real science-backed solutions. It's time to uncover what works and challenge what doesn't. Let's unlock your full health potential with an integrated approach. Ready to learn what's real? Let's dive in. All right, welcome to what I think is going to be a pretty special episode of the Real Integrative Medicine podcast. I am joined today by, I'm going to lead with my friend. We've had a lot of adventures together over the last 10 years, Katie, my friend and colleague, Dr. Katie Thomson Aitken, who is one of my favorite people to talk about mental health with. She's been on the podcast before where we've talked about anxiety, but today we're going to open up a conversation that we've actually never had on my podcast, talking about autism spectrum disorders, as well as focusing specifically on this concept of autistic burnout. So thanks so much for being here, Katie. I want everyone to feel like this conversation is for everyone. So even if this is not something that has shown up in your life quite yet, in someone you love or in yourself, I'm going to encourage you to stay and listen with open ears and an open mind, because I think this conversation actually deserves to be on everybody's playlist. Thanks so much for spending time with me today, Katie. I would love if you could share with our audience how you got to this space of working with folks with autism and where things are at currently with this conversation so that we can kick it off.
Yes. Thank you for inviting me here to talk about this, Jordan. When I started practicing 10 years ago in the mental health field, I didn't know much about autism. I had a lecture in a nutrition class about restrictive dieting for autistic children, and that was my introduction. And in my practice, I was treating a lot of folks with anxiety and mental health conditions. And through working with folks, as naturopathic doctor, we're looking for the root cause of someone's health condition. And it was actually some of my patients who came in and said, I think what this might be is autism. And maybe this anxiety that I'm feeling, this like lack of social connection, that's been labeled as social anxiety, or my behaviors that other people don't like that have been labeled as borderline personality disorder, I don't think this is right. And through following folks, going through the diagnostic process and them receiving their autism diagnoses and seeing the impact that that had on their life, their confidence, their understanding of themselves, their self-compassion, and then also through knowing, my friends and family who I have folks in my community who are autistic and have shared themselves and their life with me. So both in my professional and my personal life, growing by learning from the life experiences of people who are autistic. I try, and I'm just going to comment on my language there. I am really learning what we call identity first language, so autistic people, but you'll hear me slip up because my clinical training is in person first language. So that's a long way of saying that the autistic people in my community taught me a lot about autism and sparked my curiosity to wonder, how could I be serving the people in my practice better, the ones who came in diagnosed and the ones who came in struggling and not responding to their conventional treatment, and trying to understand where they may need more support or where we may be missing what's going on.
Yeah, I'm glad that you brought up the, where things were, right? Sort of like 10, 15 years ago in that discussion, especially in I'll say the naturopathic community. There was a lot of discussion around treating autism and how do you treat it? How do you undo it? And I would say even with like the current sort of political landscape that conversation has surfaced yet again, especially as we have particular groups, again, trying to tie sort of, vaccine injury with autism. And I think it's important for our community that we try and get into what, sort of the real conversation actually includes. Can you, for our listeners who are kind of unaware at that level of spectrum that we understand autism to currently be, can you give us a high-level overview of what it means to be autistic or be a person with autism right now?
Absolutely. I'll try and avoid the boring details of how we got there and the history of neurodevelopment, and different diagnoses ended up being grouped together to create what we now call autism spectrum disorder. And when we're talking about autism, we're talking about a neurodevelopmental disorder that's related to social behaviors, so social interactions and behaviors. And it is a wide variety of experiences, but everyone who has autism experiences challenges in their social communication, whether that's around how they're reciprocating in a conversation, or to not being able to verbally communicate at all. They may also experience challenges in their relationships, in navigating relationships, understanding relationship dynamics, and then also in nonverbal communication, all the other ways that we have social communication, from gestures and our bodies. And then on top of the social aspects, we also see this restrictive or repetitiveness to behavior, interests, or activities. And these things are part of who someone is. They've been present since their early development. So someone doesn't get autism later in life. This is something that has always been part of who they are, how they're made. And another piece is that it's causing clinically significant impairment. And so this is like when we talk a lot from diagnoses, everyone experiences traits of things sometimes as parts of being human. Where we start diagnosing disorders is when it starts bothering someone's life. And while everyone with autism can use support needs, we actually are dividing the spectrum right now into 3 categories based on how much support someone needs. And so someone who has level 1 autism, if they have a lot of support, they may not, I hate to find a better way to say, like, look autistic to you as an observer. They may not look like what you've known autism to be in the past. Someone with level 2 needs moderate support, and someone with level 3 needs a lot of support to get through their life. And I think a lot of times, especially politically, when we hear about autism right now, folks are talking about folks who have profound autism, who have large support needs. And this is an important part of the autistic community, but this is not the entirety of the autism spectrum.
It's interesting because I think when I remember, my earliest understanding of people with autism was maybe in elementary school, and you only saw the people categorized as autism who had that significant amount of support, right? I recall one student in my elementary school who had one-on-one care while they were at school. They were nonverbal. That was autism in my mind. And it wasn't until maybe, years later that I started to become more aware of just folks in the community who were on the spectrum, but were not at that level, right? And I think that that's such an important thing to recognize, because as we start to move away from that level, needing of that level of support, it really changes the fact that you can realize that there are people in your day-to-day life, in your workspace, and in your family that you're interacting with who also are living on that spectrum.
Yeah, it is a broad spectrum, and it has unique challenges at different phases. And when we look at beyond the folks that also have an intellectual disability, some folks with autism do have an intellectual disability, but many do not. And some folks with autism have very high IQs and are highly successful. And we have done a poor job of recognizing, particularly women who are quite bright, because of ways that they have been able to compensate, camouflage, or mask their social challenges with their intelligence and with using different parts of their brain to navigate this world. And we've also been gendered in our history of research. What else is new in terms of understanding what this looks like? And so, well, no one is surprised if you've got a young boy or a man who has the train tables memorized and can tell you each engine as it comes past is saying, oh, yeah, that's autism. When we make that about a little girl or a young woman who is very interested in horses, at which point does this interest in horses become a restrictive interest? And we're less clear socially when we're talking about girls and women.
Yeah, and we've seen that in other spheres, right? When we look at other diagnoses, even like ADHD, where, when we put young boys in a confined space who struggle with ADHD, their behaviors are more impactful on the other people in the room, and so they get flagged faster. The call goes home earlier. Whereas when we see those same experiences in a young girl, they're less likely to be, I use the word like destructive outward behaviors. And so the call never gets made. And that like delays the diagnosis and actually overlooks the diagnosis completely because it's not showing up in someone else's space. It's not like, it's not imposing on the teacher at this point. Does the same thing happen at this point for that difference between boys and girls when looking at diagnosis?
Absolutely. There is this piece of whether the symptoms are, I loved your words like disrupting others. I was going to use the word like internalized, which is maybe a little bit more technical. But where is the discomfort being experienced? And I think when we look across mental health conditions and certainly across neurotypes, we see this increased of internalized symptoms for women and for girls. And this is where that experience is happening more on the inside than the behaviors are showing. And there's also probably some like sex brain based decisions happening or influences there of hormones and brain development. We know that there's a difference between how girls' brains and boys' brains are developing socially anyway. And so when you have that deficit in a young girl, it's a deficit compared to her female peers who are kind of viewed in a patriarchal standard as being ahead. So she might not get caught as behind because if her skills are meeting sort of what's considered the norm.
Mm-hmm. That's such an interesting point. And I have this like sort of curiosity about how people navigate, their autism like across their lifespan, because we are seeing this discussion of more women in their 30s, 40s, and even 50s having this late diagnosis. What do you think is going on there? Like, why is this conversation suddenly coming up all of a sudden?
Yeah, because we missed a lot of them. I think for a lot of reasons, we weren't looking for autism in girls. The belief was that there was significantly more boys with autism than girls with autism. And this is still true in our diagnosis rates. We're still diagnosing more boys with autism than girls. This is getting less and less as we age. So girls are taking longer to be diagnosed, but we are catching them. And I don't know where this is going to end. Different folks are hypothesizing in different ways whether this will continue to be a disorder that primarily affects men remains to be seen. I'm always skeptical when there is that gender difference. I've been skeptical about that when it goes the other way as well. In conditions like anxiety, I worry that we might be missing men. So we'll have to see.
Yeah, and I think in a when we start to talk about like the differences, the gender differences, right? There are so many traits that that are on that sort of type 1 or step 1. I forget the language that you use there. That was a new term to me. The autism. That some of those traits we may normalize in one gender over another, right? If a male is aloof or has poor communication or makes poor eye contact, we may have normalized that to some extent, or we may not flag it. Whereas interestingly, we may do that with a woman who does the same kinds of behaviors. And then conversely, right, where we may be more more likely to flag something that's happening in a male patient than versus in a female patient. What have you noticed with respect to that? Like, as I'm particularly interested in female patients as they age with just being on the spectrum, there is like, what do we notice about those women as they age and have to learn to cope with and experience sort of regular society? How does that impact them?
Yeah, well, there's a few pieces there. Um, just talking about living a life where if you're not diagnosed, you're not getting any accommodation from the outside, and you're also not giving yourself any accommodation from the inside necessarily. And so when I think about, you know, existing through a neurotypical life, one of the things that someone might do is study how to be in a social situation. They might read a lot of books and imitate the social behavior from books. That's using a completely different part of your brain than if it comes to you naturally. And it's exhausting. So a lot of these women are tired from mimicking social behavior and from running everything like they're thinking about their social behavior rather than just having that be a more intuitive state. So it can be quite tiring. The other piece is if you don't know that your experience is different, it's just your experience. So doesn't everybody find the lights loud? Doesn't everybody find the grocery store overwhelming? Doesn't everybody find the shower annoying? Like, I could pick up any sensory example, and there are autistic people who find these, what someone who is neurotypical finds just going about their day, irritating, painful, overwhelming. And if it hasn't been diagnosed, then they're not accommodating. And the world is not accommodating for that. And so there is that piece. And I think with the other pieces with aging are hormonal changes. It may be postpartum, might be going through perimenopause and putting extra stress on their executive function that they were using to navigate and accommodate for themselves. And then the other piece that I think is really playing into diagnosing and our increased finding of these women is they have children, and they have autistic children. And, you know, looking at, your child being diagnosed or accommodated and then going, hang on, I did that. I did that when I was little. What does that mean for me? And so what I've seen is through women in my practice becoming diagnosed later in life, I've seen this both with ADHD and with autism, is a new self-awareness. And I call it, sometimes it's like a key for self-compassion, because as much as I wish we didn't need diagnosis for self-compassion. I really wish we could all just say, this is my best, I'm doing my best, and it is good enough. But we live in a society with standards and structures. And it is, I think, really affirming for folks to say, wait, I've been playing on hard mode and no one told me.
Mm-hmm, mm-hmm. Yeah, it's so interesting. And I can only relate to in this conversation, I can only relate to my own experience where I talked at nauseum with my psychologist around whether or not I needed to pursue additional assessments, like on all levels, right? From like ADHD to like mildly being on the spectrum. And for him, he was like, what would it give you in this moment in your life? And I was like, well, probably nothing, but 30 years ago would have been awfully helpful.
But you're right. Like we often need that kind of, like acknowledgement that the experience that you're having is real and it's not this perceived thing. Because I think too, especially for women, that you're always trying to figure out how you're supposed to show up, whether you're on the spectrum or not. We've spent our whole lives trying to figure out how we're supposed to show up. And so this idea that there is maybe some additional barriers or some additional things that are making it, meaning that the hard drive needs to be running a little bit more often in the background just to feel like you fit in. I think like that's such an important acknowledgement for people so that they can develop that level of self-compassion for themselves.
Yeah, the self-compassion piece, I think it's really important. And it is hard when you don't have the information, right?
What does it look like right now to get assessed as an adult female or male, but as an adult, like what, I know we can speak to geographically, what does it mean? But when we're looking at a late in life diagnosis, how does someone even start to pursue that as they're listening? And if they're thinking, this is actually something I'm kind of interested in for myself?
Yeah. Most people pursuing a formal diagnosis go to see a psychologist, a clinical psychologist, and they go through a process to look at whether what they're experiencing meets the diagnosis criteria for autism. There are, some standard inventories that are out there that people can do sort of on their own or that can be done clinically to assess these symptoms. I know when I'm working with someone and we think that, and I want to consider autism in my differential diagnosis for them, I'm often sending them to do something like a RADSAR inventory that's been designed to catch missed cases of autism. And that's often what I will suggest as a starting point is to let's just explore whether we think this is a possibility for you. Take a look at what's going on in your life. If I think that this is something that's relevant, I might give some of my reasons. And then, Jordan, just like you were saying, you're talking to your therapist of like, is this even worth pursuing? I think that's a really important question. And I talk to folks a lot about that when we're thinking that maybe this is something supportive to them. Maybe someone can't afford a formal psychologist autism diagnosis at this time. Maybe there's no benefit. We may use, we may work from a self-diagnosis perspective from that place. If they feel that this matches, what supports can we put in that are going to be supportive for you? And we'll just work from this assumption. I'm perfectly comfortable doing that clinically. And I think it's important for each person to put in supports that work for them, whether or not you are autistic. I mean, if the grocery store is loud and you want to wear earplugs, like you don't have to be autistic.
Go right ahead.
Yeah. Where I think some things get complicated with this is around the identity piece and the community piece, because folks with autism are there's something about the fact that this is a social neurodevelopmental disorder that is important. And we all as humans are looking for belonging. And I think sometimes that formal diagnosis lets folks be louder, lets them find their people more easily where they truly feel that level of belonging. But I want to say this with like a giant asterisk, because I also know sometimes there's you go through this whole process thinking, well, now I feel like I belong, and still feeling like, okay, well, maybe I shouldn't be taking up space here. Maybe I'm not really quote unquote autistic enough. And I think that this happens for a lot of different identities outside autism and neurodivergence, but it is something that happens here.
I don't know if this is you or not, but if you're a naturopathic doctor or an integrative practitioner who prides yourself on being evidence-based, but don't have time to stay up to date with the research yourself, I have a solution for you. I'd love to invite you to explore and join the Confident Clinician, the only integrative medicine clinical decision-making tool that helps get research from PubMed into your practice with ease. We have built out exactly what you need to be the most efficient in your work, to be the best in your community, and to save you those precious hours that you're spending right now doing the research yourself. Joining with our premium membership gives you access to unlimited AI searches, gives you access to all of our previous database content, as well as our upcoming year of live delivered modules. You can check out more in the link in the show notes. I would love to see you inside of our community. We're making a huge difference in the way that practitioners practice integrative care and raising the bar for evidence-based integrative medicine. I hope you'll join us.
I think anything that lives on a spectrum, right? We tend to rate ourselves against other people or other situations, right? If you are having a hard time or if you're emotional about something, it's so common that we go, well, at least I don't, at least this didn't happen, or at least, and I don't think we're always looking at that from like a gratitude bright side perspective. I think we're usually looking at it as a downplaying our own emotions perspective. Like, I've had a really emotional, terrible day at work, but at least I didn't get fired. And we can position ourselves against what would maybe be considered worse or harder as a way of downplaying our own needs or how important our own experience is. And when something lives on a spectrum, we see this whether we're talking about menopause or ADHD or depression, is we almost minimize how helpful it would be to be supported because we imagine that someone else needs more support or that it's not quite as bad as it could be.
Yeah. And this is particularly true when you know that it could be worse, right? I see this all the time in my practice with depression, right? Where folks have had maybe a bad depressive episode in adolescence, and now they're experiencing depression and they're going, this isn't depression. I was depressed then. And you're like, well, this is still, just because you didn't fall all the way down to the bottom of the pit doesn't mean you're not in one.
Yeah, but bring up a good point there around accommodation. And I'm curious to hear a little bit more about that, is that if you don't kind of, acknowledge and embrace the idea that you deserve something different, if you need something different, it's very hard to get the level of support that you need.
It is. Tell me more of what you are curious about support needs here.
Yeah, it's a great question because I think, again, when we think about accommodation, right, we always kind of imagine that word, and maybe I'm coming at it from like this, thinking about like employment sense or those sorts of pieces where it's that you can't do the thing to its entirety, and so we're going to change what the expectations are of you so that you can show up a little bit differently but still show up. And I actually don't think that's the right way to think about this, actually. I think the word accommodation in this sense is mostly like having a level of compassion and creating a space for difference. And so that if someone suddenly wants to go home from your house, that you're accommodating that by not taking it personally, that the person that's with you actually has a need that's different than what you were hoping or what that you were expecting. I think that word accommodate elicits like the wrong frame of mind, actually, because even when I think about the word, it elicits the wrong automatic thought. So I want to talk about that word and what does it mean to support and accommodate someone who has autism?
Accommodations can look all kinds of different ways. Where I hear a lot of conversation is around sensory accommodations. And so some folks who are autistic just experience so much of their sensory environment, and that can become really overwhelming, particularly if they're in a state of burnout where perhaps the lights are too much or the sound is too much or the clothes are too itchy, right? And so some of that accommodation can be personal, right? If you have a comfortable outfit that you like and you just want to wear a variation of that every single day, that's fine, right? Allowing yourself that flexibility to do what's comfortable like for you rather than to do what's expected by other people. I think that can be a big part of self-accommodation. And then social accommodation, letting people be who they are. Whether that is in terms of, like you said, not taking it personally when someone's just done, when they're done with a conversation. I think we have a lot of ideas about what is polite behavior. And I think when we're getting caught up with politeness, what we're getting caught up with is social norms. And this really is a burden for autistic people. And so just not taking it personally if someone just wanders away in the middle of a conversation because they were done with it. Like, it probably is not about you. If someone's not making eye contact, again, don't make a big deal about it. I think there's ways that we can just listen to the autistic people in our life and be willing to adjust ourselves. So much of, I think, what we have done historically with autism is expect autistic people to meet our demands, and it exhausts them. And part of our job, part of, a job of someone who is not autistic is to figure out, okay, well, how can I be part of meeting partway rather than expecting everybody to come to me?
It's funny. I think, anytime I have lots of really close friends that are on the spectrum. And to me, like, it's the most endearing thing ever when they walk away from a conversation, because I'm like, yeah, they needed to not be here. And I think that's just so great and beautiful that they did that. But initially, and I don't even know when this became part of my consciousness, is that it really required me to think quite a lot about what I expected of other people and to get curious about, like you mentioned there, that term, like politeness. Like, what does that even mean? Like, where did it come from that we're supposed to just like stay till the end no matter what, or maintain eye contact even if it's uncomfortable, or take something, right? Like, take a cookie even though you don't want the cookie. And like, at what level is that okay when we actually think about, like, many of these social accommodations is that we're actually just meeting people where they're asking to be met? And how beautiful would that be if we actually just did that for everyone?
I think it would be very beautiful if we did that for everyone. And I think a lot of these systems that we're looking at, they are patriarchal. They are built on white supremacy. It's power systems that have been working in our society to say, if you act this way, you will be safe. You will have social cohesion. And I think it's pretty cool that we're looking at these saying, do we really need this? Can we break this one? And I'm really hopeful for a world where we're less worried about being polite and more compassionate towards the fact that everyone's coming from a different place and everyone deserves to have their needs met.
Let's talk about the burnout piece, because I don't want to lose this part of the conversation, because I've talked about burnout and stress before on the podcast, but it is not the same as this discussion around autistic burnout. Can you give our listeners kind of that quick comparison around the difference between the two of them?
Absolutely. And so we are working from a working definition of autistic burnout right now. The research is new. And so this will change. But right now, when we're talking about autistic burnout, first of all, the person has to be autistic. Secondly, they have to be exhausted. Third, they are typically withdrawing from their social life. So you're seeing some social withdrawal. Up until now, you might be thinking this sounds a lot like depression, and it does. And we'll get into where we think the differences are. And then in addition to the exhaustion and the social withdrawal, we're seeing either a reduction in functioning. So this could be in any arena. This could be home tasks. This could be work. This could be social obligations or school. We might see a reduction in executive functioning, confusion, or even sometimes of dissociation. And then the other feature that we might see is increased autistic traits or less ability to camouflage or mask autistic traits. So that's what we're talking about when we're talking about this autistic burnout. It is a huge amount of fatigue. It is backing off from friends and family and social commitments and being more withdrawn. And then it also has this functional piece where we're seeing less function in day-to-day life. In terms of where this is different from occupational burnout is coming from work. And so these things can come together. Someone who's autistic can have occupational burnout alongside autistic burnout, but the cause of it is different. It's not necessarily the work demands like we would see in occupational burnout causing their experience. It really is that everyday life, managing social and sensory environments, just living in a world not built for autistic people, layering on any other mental health that may be happening for that person. It's also different from depression. And this one, it's sticky to untangle because of a lot of people who are meeting these new criteria that we're coming up with to try and assess for autistic burnout. They also meet the criteria for depression. And so we're really on the cusp here of trying to understand what exactly is happening. But I think the social withdrawal is a key place to pay attention to. Someone who's in autistic burnout is going to feel like relief with their social withdrawal. It makes them feel better to have space. They get more energy. And we know in depression that the social withdrawal is kind of like a drag downer. Oh no, I couldn't possibly see folks. And then if they're not pushing back of that, building momentum, fighting against those depressive tendencies, they tend to get worse. And then the other part that I think we can start to find the difference is engaging in interests. So when you talk about something that what brings you joy, in autistic burnout, spending time doing the things that bring you joy tend to just make you feel better overall, right? You're still getting that taste of joy. It's just maybe you haven't had the time or space to do that activity. On the other hand, we know in depression, the joy-filled things start to lose their joy. And so it's I used to enjoy playing the guitar, but it's not bringing me joy these days. That is one way where I think we're going to be able to start telling the difference here between autistic burnout and depression. And also folks can have both.
Yeah, this is so fascinating because especially as we talk about we've missed a whole lot of people, right, who are currently in their third, fourth, fifth decade of life. Also, those people who are women are spending a good chunk of their adult lives trying to mask or overcome a lot of their traits so that they can fit in or that they can, live live in society and have it not be a concern. And then we have this sort of, we'll call it a new assessment piece around autistic burnout, where maybe typically we were taking these women who were not diagnosed, who then have spent decades trying to mirror a lot of their social behaviors in order to fit in. And now we're diagnosing them with depression, where that whole thought line is wrong if we miss the assessment in the first place.
Yeah. It is, and there's a lot of diagnostic overshadowing, meaning that people get, and specifically women, get a label of a diagnosis of something that's easier to catch than autism. And that becomes then the lens that we view their health in. And we can miss this. So on the one hand, we have a lot of folks that we have missed. And on the other hand, we have this beautiful opportunity, if we correctly identify autistic burnout, to then possibly pursue diagnosis. And that can be a really healing and life-changing moment for some people, to have this acknowledged as where their health has come from. I think there's some opportunity here as well.
Yeah, I like that. Diagnostic overshadowing is a great and new term for our listeners. I always used to describe it to patients as being like typecast, right? That you had a diagnosis in your teens or 20s or 30s that was related to your mental health or your functioning, and then you carried it around when maybe that's actually not who you were then. Maybe that's not actually the most important part of the way that we talk about your mental health or how you show up in the world. But when you have that label that you've been given back then, like, you can only be in a romantic comedy and that's it, that's the way we look at you from then on. It's important, I think, from a practitioner perspective, that we're willing to reevaluate, right? If we actually have the correct label, or if the person actually requires two labels to be able to describe their experience completely. Because so many times I would work with women where they're like, well, I have such and such, right? Whether it's an anxiety or PMDD, but I don't quite fit. Like they even themselves knew that their picture was painted a little bit differently than the very classic diagnostic criteria. And then it would come out, much later, that actually the parts of the painting that are different are actually on the spectrum. And that's where we need to focus and look at it.
Yeah, it's important to think about the fact that we're really only looking for autism in boys. And when you're not looking for something, you're not going to see it. And then, but people were still struggling, right? And so, maybe they received a diagnosis of borderline personality disorder. Maybe they received a diagnosis of OCD or anorexia. When we think about how autistic traits can play into eating, we have a high comorbidity with anorexia. And so, or we used to believe that you couldn't have ADHD and have autism, and that is no longer part of how we diagnose either of those conditions. But there's a legacy there of folks who were diagnosed with ADHD, and that meant no autism. You don't have that. You have either or. And that's not true. A lot of people with ADHD also have autism. And so when you get that diagnosis of one thing, it creates almost like a lack of curiosity for the next piece. And while, of course, folks can have multiple diagnoses, when we're talking about women who are diagnosed later in life, a huge majority of them feel that they were misdiagnosed when they had a label previously. And so that's something that we have to sort through as well, is when are we actually just wrong about this? And we've picked an easier diagnosis, a diagnosis that were more, the clinicians gone with what they saw without understanding what was really going on. I think a lot of this is well-meaning, I'm sure. I mean, we're all human, everyone makes mistakes, but questioning how can we do better? How can we notice autism in women? And I just want to say for a minute here, I know I've been talking about women for a long time. The research is very gender binary. We know that that is not how people are in the world. And we're also learning that autistic people have a greater diversity in their gender expression than in the non-autistic population. And so I just want to bring that in. I really hope that our research catches up with this and that we see more research that takes into account the gender diversity. But for now, we're kind of stuck with researching women.
Yeah, if I was going to think about some like overall takeaways from the conversation here, Katie, it's like, I think we wanted to build some awareness and compassion, and we'll use the word accommodation, in our listeners who do not have autism, right? And I think it's a really great reflection moment to think about what happens inside of you and what happens inside your brain and body when you are experiencing a situation with someone who has autism, who responds differently than you expect. I think it's an incredibly important self-reflection moment to understand and think about your own capacity for compassion. I think it's such a great litmus test, because maybe that is a great mirror for you thinking about you being compassionate for yourself, right? If you aren't, accommodating for other people who have different needs, are you are you doing that for yourself? So I think that's like a really important piece for our listeners who listened out of curiosity for this particular topic, who are not autistic. I wish that for you, that you kind of take this away and think about what happens inside of you when you need to support someone who is doing things or needing things that are different than what you expect. I think that's a really sort of cool and curious place to be. For people who are curious about their own neurodiversity, I think this is a really great conversation to be reminded that the landscape has changed, that we are talking about a lot more people. We're talking about women. And I remember those stats. It was like 300 boys to 1 girl when I was in school. I remember memorizing that statistic. And that's just a mistake, right? That's just a we weren't looking statistic. And so if you're listening and you're like, this actually has made me quite curious about myself, I think that's really important. What else do you want our listeners to take away from our conversation, Katie?
I would love people to take away thinking about social situations and social accommodations differently and with more compassion. If you're moving through the world and it's uncomfortable, I know I've said that like finding that diagnosis is the piece that sometimes unlocks that self-compassion. But I just so badly want everybody to have this, even with or without the diagnosis. And I think the more we listen to an autistic experience of, I'm just stuck on the grocery store today, but like navigating the grocery store noises, right? Like it's okay to use that whether or not you are autistic. And I think our world gets better the more we listen and the more we include autistic people in our communities. I know that for me, I am not autistic. And so I can only speak from what I have learned through listening to autistic people. And that is really where I would like to leave here, is that I hope we can continue to listen and learn how we can accommodate and make changes into how we show up in the world to make it more welcoming for everybody.
I think that's such a great message. And yeah, I think we hit a lot of our goals that we wanted to have and you can even, I love even just the pace of this conversation, Katie, because it's a good reminder about how much language matters and thinking about what you're saying matters. And that inclusive discussion is actually quite a slow and thoughtful one. And I think both of us are trying to hold space for all the people in this conversation. I think that's really important, that even as you're listening, and hopefully you're not listening on like 2x speed, because that always bothers me when people give me feedback that they listen to my podcast on 2x. I'm like, you're missing the point. You're missing my tone. Just how important that is, right? That's actually like a careful, thoughtful conversation, because that's how we want you to experience the world and people with autism, is with a careful curiosity. So I think that's really important. How can our listeners find you, Katie? Because I think the work that you do with people is so important and so profound. I would love for them to leave with a little bit more from you and how they can learn more.
Yeah, if you want to connect with me, you can check out my website, which is www.tranquilmindnaturopath.com. And for social media, I primarily hang out on Instagram, and it's at Tranquil Mind Naturopath there as well.
And we'll put the links to that in the show notes, so you have a quick access right from wherever you are listening to the podcast today. Thank you so much, Katie, for us having this like super important conversation that we've never had before. And so that always makes me happy to broach a new discussion and expose our audience to new ways of thinking about their health.
Thank you. It's my pleasure to come and share what I have learned about this with your audience.
That's it for today's episode of the Real Integrative Medicine podcast. I hope you're feeling inspired, informed, and ready to make changes that truly support your health. If you found value in today's discussion, don't forget to hit subscribe, share this episode with someone who needs it, and leave a review. It helps us reach even more listeners just like you. Your health journey is personal and it's powerful. Let's keep building on the knowledge to give you the confidence you need to thrive. It's important to remember that the Real Integrative Medicine podcast is for educational purposes only. Be sure to talk to your doctor before making any personal health changes. This podcast isn't intended to diagnose you, and no doctor-patient relationship was formed by listening. We'll see you next week.